West Michigan. This is Tap In, newest podcast. Wait, no, ready? I'm going to try it one more time. 5, 4, 3, 2. Hello, West Michigan. My name is Pamela Keim, and I'm with Stephanie Kolakowski, and this is our Tap In podcast, our second one. We have a fabulous guest for you today, and we're just trying to get out, learning how this all works, right, Steph, instead of being right in front of the camera, this podcasting?
Absolutely.
All right, we're gonna tap right in right away, and I'm gonna hand this over to Stephanie, and she's gonna introduce this week's guest. Here you go, Steph, take it away.
Absolutely. So what I love about this intro from today is that it is so real of what's going on right now with pivoting during the pandemic, right? And we've got 3 powerhouse women on the podcast today. And our guest today, I'm super excited when we talk about pivoting and addressing, concerns relating to mental health and introducing a new model, right, of health clinician to consumer model with her company, the CEO of US Telebehavioral Health, is here today, Susan. So Susan, you got your hoodie all situated today. Are you ready to rock, girl?
I was laughing because I took one hoodie off and then just put on another one. Working from home for 4 years, I feel like I'm in a different stage of my evolution than a lot of people. So I'm the CEO and founder of Telebehavioral Health US, and I founded the company in 2016, not as a pandemic response, but as a way to address what was until last week the leading source of disease burden in the United States, which was mental illness. And at the same time, we also have a massive health provider shortage area. And at the same time, it's a female-dominated profession. And in my years of experience, I've been a student and instructor, a clinician, and many other things. But I've instructed as an adjunct instructor, and I know one of the early messages in social work is you won't make any money. And so another perpetuating factor is just social workers going, okay, I'm called to do it. And I don't know many radiologists, anesthesiologists, oncologists that take that same model when it comes to their calling or their profession. So I saw telehealth as a way to leverage technology to not only increase access to the 111 million people that live in mental health provider shortage areas in the US, but to also address the workforce conditions for social work that perpetuate that workforce crisis, the shortage, and then also not being able to effectively address that disease burden as a country. So we're able to, because we have no office space, we actually, as far as I know, we are one of, if not the only healthcare organization that has absolutely no office space in the United States. I would love to find another one because I'd like to put heads together with them and how to navigate some things. Traditionally, and that might be perplexing to some people because of companies like Talkspace, Breakthrough, BetterHelp, Open Path Psychotherapy Collective, MD Live, Insight Regain. All of those companies, they're not healthcare companies. And actually what's really important for consumers to know is that they're not bound to HIPAA. Insurance companies don't credential and panel and cover services covered by software companies. If your insurance company does, it's because they've found an alternate route to provide something in lieu of therapy, which is also why we're so proud of our slogan, which is same therapy, different couch, because that's the definition of telehealth is providing that same service.
So your name of the company is Telehealth? Is that
Telebehavioral Health US?
Okay. Just wanted to make sure. When I was coming through I wanted to make sure there was clearly that people knew.
Thank you.
No office space. And
no office space. So also one of the most green healthcare organizations in the US because we don't have any commute and no office space. So we're able to increase our workers' wages by saving those overhead costs. And we're also able to offer them more flexible work from home abilities. They do contracts, so they're considered self-employed. We know that social work is 80% female dominated. And
why do you think that is? Why do you think that is? Is this because I would have to say, do you think we're just more attuned to emotion than sometimes guys are? I mean, I hate to say that, but some of us are. We can pick up on things faster. What's your thoughts on that?
Without upsetting a whole bunch of people regarding non-binary gender, there are neurological differences between male and female, just as there are differences in how we carry our fat and our muscle and all of those things. And so I would say that it is something about that. But it's also that social work was founded by women in the 1920s with the Hull House. I believe that was in the 20s. And so it's just always been a female-dominated profession, similar to teaching and similar to nursing, who also have huge workforce shortages and not the best workforce conditions. So as I got further into this, I started the company in 2016, not knowing if what I was doing was going to work, but I had nothing to lose because I was a company of one. And it just cracks me up because for 4 years, I felt like the Wizard of Oz. I would refer to the company as we and us. And,
I know what I always said. Instead of who's going to take care of that? Well, me, myself, or I. And we just yell at each other at meetings. Why me, myself, or I didn't get things done.
When we started scaling, I did an org chart and it was like 8 boxes and it was all me. I had to learn as a social worker too, how to do a lot of things outside of my wheelhouse. And I also began encountering a lot of things like barriers to insurance credentialing and paneling that social workers actually perpetuate their own oppression with. So our credentialing, I was told, for 3 companies, 3 insurance companies for 1 clinician. I'm in with over 25 payers in 5 states, that it would be $850 just to add a clinician. And I couldn't afford that. I couldn't afford to scale because I built everything with no investment, just sweat equity.
Right.
With a ton of investment, but it was my own sweat equity. So what I learned was it's because social workers don't understand the credentialing process. They don't know which documents to pull forward and to get to that specialist. So the specialist wastes a lot of time chasing down those documents at $90 an hour. So what I did was I used a training platform called Trainual. If you've ever taken like a HIPAA compliance or safety training or onboarding training through a computer platform, it's very similar to that. You have the little quizzes and you click yes. And so let's
talk, Susan. Okay, so I'm a company, right?
Real quick, I will land the plane on that. We knocked that credentialing cost down by leveraging technology to $35 per clinician right before the pandemic. So that was my last barrier to scale. So when the pandemic hit, we onboarded as many people as possible because we saw the workforce destabilizing more. And in the past 6 months, our revenue growth has been 800%. We've added in numerous new programs. We've added 25 clinicians, medication management, services specific for seniors. And so the past 6 months has been a complete whirlwind. Sorry, I didn't mean to cut you off.
No, that's okay. Go ahead, Susan.
I left it a bow and
Susan, first of all, I admire you. We had the privilege of meeting at the end of last year when we were both bootstrapping and getting started and following our hearts and our purpose. And you said something earlier that I love, and it's one of the things that connected and resonated with me when you and I first had our first call, is your calling to do this, your purpose-driven self. You're not take no, but figure out, ask questions, figure out how you can serve, how you can help and align and build this business bootstrapped. And I think you hit on a really key point for me. And I know Pam is bootstrapping her business as well. And anybody, and it's not a male-female thing, but I do find that most of the conversations I have with females, there hasn't really been any that I've had that have actually scaled something, that I've had somebody come with this magic wand of financial capital, right?
Women, I feel like we are locked out of investment opportunities a lot. And that whole route was a nightmare for me. I'm really proud of what we ended up doing because we were seeking investment. And I think last time I talked, we had gotten very close with investors. An offer was on the table. And then we just, and I don't know how it was missed because we had a psychiatrist who openly identified as queer on our website with a profile as a main page, but they didn't appreciate our endeavor to become a more gender affirming workforce by recreating that model and having a budget of under $1,000 a month to pay peer specialists to sit in our clinical discussions and our hiring and our program development and help us not do compliance with that through trainings and checkboxes annually, but actually infusing it into our culture. And so that offer was pulled and I was devastated. But what going for investment did teach me was a lot about the world. 2, that we didn't need as much as we thought we needed at all. So what we ended up doing was we took social workers, teachers, nurses aren't walking around typically with a ton of money in their pockets to invest. And those are from our 3 main female dominated professions. And so the majority of our female workforce isn't looking for investment opportunities. So what we did, we know they'll work for almost nothing, right? So what we did was bring on people on board and offer them, if you'll take a reduced salary from what you're making right now, we'll tally that up and include that in an investment, and we'll sign over shares and equity to you, and you'll be a part owner of this company. So now we have all female investors, except for some family and friends, who have used their knowledge and their expertise to have part ownership in this company that we plan on growing to being available in every state within the next 2 years. So
that's amazing. That's amazing.
Exciting.
Thank you. I think that is what in our circles too, like, is how do we as females perpetuate that, right? And create our own holding companies. And micro lending being in need is something that I'm completely same thing, right? Taking a step back and using talents to say, how can we all come together and form this amazing circle of talent and opportunity to scale businesses, understanding that we don't need what we didn't, what we thought we might have needed. But at the same time, also walking that fine line to say, once something is established to get to that next level, how can we encourage others to join in and give the growth capital needed to scale the way we need it to do, right? So I
would love to educate women about this model. And if you can, and I cut you off again, I'm so sorry. I'm so excited to talk about it. It just, when you look at investment as more than money, it offers more opportunity. It's something that we are very proud of. I think it can be recreated in other industries as well.
So how many employees do you have now? Because it was just you.
We have a total of 30 people right now. We also became an affiliate with GVSU. So I had been hearing kind of rumblings of from students, actually, concerns about going to work in person. I remember years ago, I was at an organization. It's a wonderful nonprofit in Grand Rapids. And we had an annual disaster emergency response training day. This was back in 2007. And that year we decided to do a flu pandemic. And, the big thing was, it's not a matter of if, but when. And so we were all sitting on this day in this thing, and we had a jar with our staff names on little labels around it. And they'd tell you which of your staff, they'd pull a staff out of the jar and say, this person's sick. And after I think week 3 in our pandemic exercise, when masks weren't even mentioned, dog washing stations were, but not masks, which surprised me. And that's not a political statement. That just really, I'm like, how did we miss that in that whole exercise? But I said to my organization, take my name out of the jar. I'm not coming in. I make $37,500 a year with a master's degree. I'm the only parent to a child. Take my name out of the jar. I'm calling or not. And I felt so guilty. And people are like, oh, Susie, you don't mean that. And yes, I absolutely do. You cannot expect me to risk my life and the only parent this child has for $37,000 a year. So I kept reflecting on that back when this pandemic hit, and we look at which workforces are the line workers. And again, it's teachers, it's nurses, it's food and beverage, all industries dominated by women. So it was really important that we offer that opportunity to people, and especially interns, the people entering the field. So I called Grand Valley in late July, and I said I was going to wait a year to do this because I love Grand Valley and I love their program. And but we would like to take on some interns now, because we're concerned that you're not going to have placements for them. So we became like a last minute affiliate with Grand Valley. And I've always seen the world quite a bit differently because I'm on the spectrum. And so I think that also, to me, that's a blessing and not a curse, because it helped me to see behavioral health disparages different and see the way that they're perpetuated and address those perpetuating factors. All the technology in the world, all the platforms, all the evidence-based practice, if we do not address the workforce conditions, we're going to keep mental illness as leading source of disease burden after Corona has been resolved. And that's just a fact. And we know that because we invest $500 million a year in companies like Talkspace, BetterHelp, MD Live, and those software companies. They employ over 10,000 clinicians, none of them clinically supervised, which horrifies me. And we haven't seen a lick of difference in that disease burden. We've only seen it get worse. So now we can say to social workers, whenever they say to me, it's not about the money, I'm called to do it, I say, no, first of all, you're putting yourself in the grave quicker, and you're perpetuating me going in the grave quicker, because we die younger as social workers at the end of the day. So no, and secondly, by 2025, our the United States is going to be short 250,000 behavioral healthcare workers. So you cannot be in demand and provide treatment for the leading source of disease burden in the United States and not expect to make money. So it's really about educating social workers about that as well.
Well, don't you think, okay, so you're working with Grand Valley. Now, this is, I usually ask the questions are like behind closed doors. You know, people that get, you know, you sit around and we have the coffee and we're like, all right, now you are in college. You say you have your master's degree. You're making $37,000 a year, which is nothing to
That was in a
world.
Clinical supervisor position,
right?
Running a shelter for runaway homeless youth.
I am looking at this, and that is a very stressful job, right? Because I know I have friends that have gone into social worker, and they okay. So Grand Valley going and having you guys do this. Why aren't they advocating to businesses to say, look, you guys are more valuable than you think? I mean, social workers
or industries where people don't have their basic needs met, and we have these workforce conditions where there's huge rates of burnout and earlier mortality rates and mental health problems and substance abuse problems. What that tells me is that workforce, if we think about Maslow's hierarchy of need, which is that triangle, on the bottom you have your basic needs, food, water, shelter, then you have like your social, emotional, then you have self-actualization, where all the cool stuff happens. You know, when all of these are taken care of, you can think of what's next for me. For 4 years, I have seen social workers that I love and know who operate in every capacity. And this has been also parroted by, and I'm sorry, but the National Association of Social Workers, void of discussions about telehealth, absolutely void. And what that really affirms for me is the workforce did not have the time to look up, because the basic needs weren't being met, and think, how would I integrate technology into my practice? I did go to universities, none shall be stated, 4 years ago, and say, by the time that your juniors right now who've declared this as their major get licensed, we probably won't have state licensing, and much of our work will be done online. There's no, in terms of which is better, people will say in person is always better. I do not agree, and I used to, but online, the outcomes are no different. It's much safer for the worker outside of COVID. As a social worker going into homes, I've had my physical safety feel threatened on many occasions, and actually be threatened on many occasions. You know, you can't spit through a camera lens. And the discussion with social work, what I would hear was, well, is it ethical or is it legal? And I've been in the field long enough to know that when people say is it ethical or legal, what they really mean is it reimbursable? But there's nothing different ethically about doing telehealth than there is in person. You just have different ethical things, and similar ethical things come up. I don't know that it's ethical to expect somebody with severe anxiety and agoraphobia to drive to an office. I don't know that it's ethical to expect somebody in the UP, where almost the entire state of Michigan, besides 4 counties, almost the entire country is a mental health provider shortage area. So somebody in the UP with a teen whose suicide is the second leading cause of death for, it's actually 10 to 34-year-olds now, to drive 3 hours to a therapist. I don't know that that's ethical. When telehealth
let's talk about suicide, because that's, I mean, that is like, do people still want to talk about it, or tell us the difference between you're stressed out, you're really going to do it, or these are normal thoughts when you're going through a difficult situation?
I feel like for me personally, passive suicidal ideation, which is, I wish I wasn't around, I don't want to wake up, people would be better off without me, and thinking in that way, that's like at least one Tuesday a month for most people, especially like during the pandemic. You know, we have had a huge change in our status quo, and it's not been a healthy one, and we've not been taken care of. And so but we know that suicide since 2016 has gone from the second leading cause of death for 14 to 24-year-olds to 10 to 34-year-olds. Oh, that is huge, and it's preventable.
What are you seeing on the suicide, though? Is it because social media, and they feel like they're comparing, they're being pushed out, they're growing up too quickly? What do you attribute that to?
People probably aren't going to like my answer, but I attribute it to there's a population that is being kept broke, impaired, and incarcerated, and for oppressive reasons. And at the end of the day, we know it's preventable. We know that it's treatable. And one of the strongest links so as a clinician on a clinical level, I feel like I treat 2 things: inappropriate guilt We don't need to always be apologizing for everything. And going back to female-dominated professions, really quick, Rashima, I can't think of her last name, Sanjir or something, the woman who created Girls Who Code, has an amazing TED Talk. And she talks about why there's these discrepancies, because women are not coded to say no. And we need to work with women to say no.
Snap
and it's
on
okay.
That, girl. That's
well,
yeah.
Stephanie and I can understand that. The more you have to say no to things to scale yourself to get more success in other areas. And everybody, once they start seeing you start doing well, they all want a piece of you, and you have to turn it. It's nice for them to want to be around you, but all that does is bog you down even more. I hate to say that. You have to say, I can't spend time with you. I've got to say no to some of these things, right, Steph?
Listening to that podcast, that TED Talk, changed my life. And I remember sitting in the garage as I was starting the business, listening to it and just breaking out and crying, because she phrases it nicer. She says, girls are socialized for perfection, and boys are socialized for bravery. And what this means in the future is a man will apply for a position if he meets 60% of the criteria, but a woman won't unless she meets 100% of the criteria. And
that's
that
so
is
true. That's so true. Yeah.
You know, and so it's that requiring perfection. And so it's really encouraging women to empowering them to be brave. But going back to mental health, I say that I treat two things. It's guilt and sleep. They're the most lethal week in the country is the week after we lose an hour of sleep collectively. We keep having more expectations dumped on our plates as parents, handcrafted cupcakes, not just normal ones. You know, I remember there was a Facebook post about when in the 80s, my mom would lock me out of the house and drink tab and give me bologna sandwiches for lunch. Like, we continue raising this bar of perfection on ourselves. Right. And what we see is trends of humans getting less and less and less sleep. And there is one way to become psychotic, one sure way to become psychotic in 7 days, and it's to not sleep. And just as anybody with a parent knows, when you send your child to a sleepover, somewhere around 6 o'clock the next night, you have to have a discussion with yourself, but your child is not possessed. You remember they were at a sleepover last night.
Right.
We're the same creature. We have increases in depression in the evening because we're tired, you know, but we make all of this meaning out of it. And so it's same thing with, and I need to say this too, school shootings and school violence. We are depriving our teenagers of sleep so that they can get through an associate's degree by the time that they graduate high school. And from my perspective, even as a college instructor, an associate's degree is basically high school repeat, and I don't think it's necessary. You know,
I don't either. It was exciting for two of those years paid for already under the school. You know, that's kind of nice. But these kids are like, now they're 4.6 and now it's 4.8. It's 4, you know.
Yeah.
What is it gonna get, you know what I mean?
I graduated high school with a 1.9 and college with a 3. And then I graduated with honors from Grand Valley. And here's one of the reasons why is because school is not built for neurological diversity. And so we have populations of students who don't feel successful academically until they hit junior year of high school. It's been since they were with glue sticks and glitter, since they had an A, and we're damaging them. Right. And their self-esteem.
I did better in my 30s than I did in high school. I mean, I just kicked in. It just kicked in, right?
Yeah.
And
I got a W every semester in college in math. It was, you know, I tried to convince my parents it was for winning, but it was for withdrawal.
Yeah.
You know? But
even boys are that way. You know, they don't develop you understand that, develop part of their brain. They say we could just wait until the boy turns, or the male turns 25, 26. All of a sudden, I don't know what happens. I mean, me was 30, but I mean, it just started to click, and I was like, I wanted it. And then I was shocked, and my brain just kind of opened up. I wasn't bogged down with peer pressure. I wasn't bogged down what people thought. I wasn't bogged down on trying to, you know, impress a guy. I was there to learn. I wanted to know and get in. Yeah.
And that's that self-actualization. Right. You know, that's that I've got all these other thoughts off my plate. I don't have to worry about these things now. Right. And now I can focus on what's really important and dial it in. So
I loved it. I loved college. I hated high school. I hated it. But okay, so all right, you know, back to, let's talk about what we really wanted to really have you on this holiday. We have this expectation. Now it's even worse today. what's going on this year. People, and I'm a Hallmark girl, so I will tell you that, and Steph knows that, but our expectations of what it is, and then you get with your relatives that are the ones that pretty much caused you to be neurotic already. And I'm already hearing everybody say, God, I don't want to, it's just, they don't want to spend it with their relatives, but yet they know. I mean, let's talk about how we can help start giving us something to do to try to handle those situations, because they are family. You can't pick your family.
I think that it's really hard when family engages in behaviors or says things for us not to make meaning of it. And making meaning of things, that's our psychology. We make things mean everything. But we have to be really careful of the meaning that we make around family, because typically we make it mean our specific negative core beliefs. So Uncle Kevin says, hey, you look like you lost a few pounds. And my meaning is you saying I'm not trying hard enough for my diet. Like what? And on a good negative core belief day, somebody could say happy birthday to me and I'd be like, I'm trying really hard already. So one is to not, the 4 agreements are really great for the holiday. Don't make assumptions.
Yeah.
Don't take things personally. Yeah. Be of your word and just try your best.
What about when you fall back to your siblings, you start falling in the roles that you grew up with? What do you do with that situation?
There's actually science behind that. If that holiday party is in the home that you lived in when you were 14,
right.
When you return to the home that you lived in when you were 14, you are more apt to return to those behaviors and interactions with your family. So I think that we also have to realize that right now everybody is not doing well.
Okay.
And even from someone who I isolate as it is, being on the spectrum, a shutdown bodes really well for my my neurology. And but it's still very hard. We're all very isolated. We're having to learn new things.
Right.
And people are dying, and so I think it's just giving people grace. And maybe this holiday season, we let go of those red flags that would trigger all those repeated arguments we have with families, those discussions
right.
that we have that never go well. Maybe we just shelve those and do the world a favor.
What about the family
season?
Susan, we've been divided as a nation, and some families are experiencing that division, where one or two, maybe even siblings, aren't talking anymore because of the either political or the virus, or somebody's taking the virus more serious and someone's more lax. I'm dealing with that myself. So give me some advice on, I've asked for, I give them a hug, I forgive you, whatever, but still that tension, and we're still not talking.
Yeah.
You're not talking. So what do we do there?
Well, my family would say, put on your best face and go, but I also don't go home during the holidays. I think it's really just, we have to make some conscious choices and some realistic choices. If you feel that being around your family is going to be worse for you in your mental health, then it's okay to set boundaries and say, if these discussions come up, I'm probably just going to go home. We don't have to have a fight about it. It's okay. Right. I'm not in the mood today. I feel like this could be a whole family therapy session in general.
We're going to have you back on that, because I think we're dealing with that.
I think the one thing I would encourage people to do is concrete operations is what we grow out of when we're 9, 10, 11 years old. And for some reason, the powers that be keep wanting to dichotomize us into this. We have a 2-party voting system, which, is a setup. You're either right or you're wrong. It's the Sith Lord BS. You're with me or you're against me. And what we have to have is more flexibility in thinking and allowing people to have their beliefs and seeing that, even if we don't agree, even if what they might believe turns our stomach, and even if it's fundamentally wrong and keeping others more isolated or, resulting in seniors dying and declining in isolation, or regardless of those things, if there's 2 chairs in an argument, and if you're arguing your point of view, they can't sit in your chair. You're in it. So if you put down your argument and you just listen and breathe and even dissociate for a minute if you have to, a little 5, 4, 3, 2, 1, see, hear, feel, but just be with them. And
don't take it personally, right?
Don't take it personally. And what that does is that opens up opportunity for curiosity, and they have felt heard. And then a dialogue might actually be able to begin. But we have to stop seeing that because you believe this about this topic, that means you're that and I'm this. We have multiple different levels of marginalization and privilege in the US. And we have to stop seeing things as either with me, against me, right or wrong, black or white.
All right. Yeah. Susan, we already are on our 30 minutes. We're going to have you back. Stephanie, you take over. I've been asking her all the questions. So wrap up.
No, I love Susan. Susan, you made some very thought-provoking things today for all of us to consider. I couldn't agree more, where we have to allow more space and more grace. I think space and grace are two key words.
Space and grace, yeah.
Space and grace, right?
Mm-hmm.
And the holidays is a really good time to remember that, right? There are core values and what's really important, and the love of family, and understanding that we all have our own thoughts, feelings. We all come from different lessons and walks of life, but just allow that space and grace to be one this holiday season.
Uncertainty perpetuates feelings of scarcity, which makes us operate in ways that are in conflict with our beliefs and values. So we just be with people. Don't make meaning. Don't try to instill beliefs. Just be with them if you can. And if you can't, give them all hugs and tell them you'll see them next year.
So it's only 2 hours. It's only 2 hours. It's only 2 hours.
Yes, we definitely need to have Susan back on.
Yeah, we will.
Thank you so much.
It was so good. Thank you so much for having me. I appreciate it.
Happy holidays. Merry Christmas.
You too. Thank you.
All right. Bye. This is Pamela from Grand Tap Media. And I'm with Stephanie Kolakowski from Grow Business Today. And this is the end of our, till next week. Take care.
Oh, wait, Susan, we forgot one critical thing. How do we tap in to your company? How can we tap in and get to know you?
Oh, there we go. That's a good one, Top.
She leave?
She left us, dear.
Okay, well, we're out. We're tapping in, but no, Telebehavioral.
We'll put it in. We'll put her information on there, right? All right. All right. I'll catch you later, okay? All right.
All right.
Take care.